There are multiple sites on the body where body fat can be measured, but for this video we will be focusing on the 7 sites consisting of the triceps, the subscapular, the suprailiac, the chest/pectoral, the abdominal, the mid-auxiliary, and the thigh. Spots should be marked before beginning to take measurements. When taking measurements, the caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and the finger, perpendicular to the skin fold. A pin should be maintained while reading the caliper. Wait 1 to 2 seconds before recording the measurement. Make sure to rotate through the different sites and not remeasure a site back to back in order to allow time for the skin to regain normal texture and thickness. Take duplicate measurements at each site and retest the duplicates if they are not within 1 to 2 millimeters of each other. All measurements should be taken on the right side of the body while the subjects remain upright. Now here is an example of a caliper, and we can see where the numbers are located as well as to which side to use to pinch the fat and to get the readings. When marking the triceps site, it will be halfway between the acromion and olecranon process. The subscapular mark will be 1 to 2 centimeters below the inferior angle of the scapula. You can have the subject put their right arm behind their back to help identify the scapula. For the chest marking for men, it will be 1/2 the distance between the anterior axillary line and the nipple, while for women it will be 1/3 the distance between the anterior axillary line and the nipple. For the abdominal marking, it will be 2 centimeters to the right side of the umbilicus. The suprailiac marking will be in line with the natural angle of the iliac crest and will be taken in the anterior axillary line right above the iliac crest. The thigh marking will be on the anterior midline of the thigh, midway between the proximal border of the patella and the hip. The mid-auxiliary marking will be on the mid-auxiliary line at the level of the xiphoid process of the sternum. The triceps measurement will be a vertical fold, as you can see right here. The subscapular will be a diagonal fold. Make sure you can see the numbers while you're reading. The chest will be a diagonal fold as well. The suprailiac is also a diagonal fold and will be the last diagonal fold for these 7 sites. The abdominal site will be a vertical fold. The mid-auxiliary will also be a vertical fold. And lastly, the thigh will also be the vertical fold. You can have the subject rest their back foot on your foot in order to help them relax the leg muscles and get an accurate reading. To calculate body fat percent, we must first find out the subject's bone density with one of these 2 equations. They will be separate for each different gender. Once the bone density has been calculated for, we can use Siri or Brozak's equation in order to get the body fat percent of the subject.